International healthcare leadership was formed about a decade ago in response to what I saw as a need for modernizing and improving management practices in Chinese hospitals. And I got my experience in Chinese hospitals as the chief medical officer of a group called Children of China Pediatrics Foundation. That foundation is a philanthropic, not-for-profit that provides medical care for Chinese orphans and indigent children under the auspices of the Ministry of Civil Affairs. And that it gave me experience, direct experience, in many Chinese hospitals across the country. And I began to feel that if I really wanted to impact access to medical care and improve the care of children in China, that I should do something in the area of management and also in the area of clinical training. So IHL was born as a result of that desire. It's a not-for-profit incorporated in New York City. It is designed to be self-sustaining by providing management products for Chinese healthcare professionals. That is to say, presidents, vice presidents, and department directors, and to work with the government and with universities and with hospitals to try to bring those three areas together, which unfortunately doesn't happen all that often in China. So we're looking to help provide a kind of U.S. substrate to try to bring those people together. We have been growing and becoming more successful. We had our first international conference at Columbia University for Chinese hospital presidents, which was co-sponsored by IHL, of course, and the Ministry of Health in China and the Chamber of Commerce China, along with some other organizations in China. And the format is 30 healthcare leaders at Columbia University with a curriculum that's supported primarily by faculty from the Mailman School of Public Health at Columbia. That IHL was in a sense formed inside of the Mailman School. We have close geographic proximity. The Mailman School is a short walk from my office in the hospital. And we have, I've been friendly with the last three deans of the management school. So we managed to maintain those relationships and use their faculty for most of our training programs. There's in addition to that program, and we had our second one just very recently in this summer, my organization has also sponsored seminars in China, and we've had, what I try to do is to include a curriculum that's practical, that allows a manager or hospital governing expert to be there and actually come away with the practical points about management and practical points about growth of their hospital services and quality and safety, but also to sneak in a little bit of how healthcare policy and development of healthy healthcare policy can help them or affect their management styles and techniques. And this has been a kind of constant theme of our offerings here. I think that at this juncture, everyone wants to have impact. I mean, I want to have impact. That's why I went from just providing patient care to providing management training and trying to provide education for clinical experts from China at Columbia as well. And so that step is taken. We offer and we have contracts with hospital systems and individuals here in China to provide clinical observerships at Columbia University hospitals in various specialties, not just orthopedics. I mean, I have more non-orthopedic clinical experts than I have orthopedic ones. And then, at this point, we realized we need to have more impact. We need to move to media. And that's where I think that partnership. So I think that that's where our partnership with #1 medical channel would be important. We are developing content, clinical content, around for training physicians. We also are developing content for management training, which I think would be much more available to more physicians and more providers if it were properly interpreted and distributed, via a media giant like you. So this is where we're working right now.